I've been delighted that Leeds City Council has commissioned this work. It's wonderful that this is the first comprehensive view of men's health across the country. It paints a picture of poorer health amongst men. It also sets out some of the opportunities that we've got to improve that.
There are many things that Leeds are already doing really well in terms of men's health. They commissioned the report, and that is tremendous. This is the third biggest city in the UK, and they commissioned a report on men's health. That is a great statement. They have a long legacy of good work around men's health with the Leeds Men's Health Network, Space 2, the Crypt, Simon on the Street, a variety of different initiatives that have already been set up to try and reach out to men. And now they're trying to say, well, okay, well, what else could we do? And partly it's about recognising men in the system. Where are the services? How are they being commissioned? Can we get a more effective way of reaching out and targeting them so that more men engage with the services?
We need to use this important report. We need to communicate the findings of this report to our partners across the city. It does help set priorities for the future. We've also got to make sure that the men's health dimension starts getting incorporated in the work that we're already doing in the city. We have a huge number of partnership activities to improve health, whether that's child-friendly Leeds, making Leeds a better city to grow old in. We're doing work specifically on inequalities and poverty. And what we need to do is bring the findings from this report into that work.
Men seem to have these health challenges partly because of our biology, but mostly because of our lifestyle and our social circumstances. Not just in terms of the way men are brought up to be stoical and strong and not to complain and not to go to the doctors, but also because we find that their lifestyle, they smoke more likely to smoke, they're more likely to drink heavily, they're more likely to be overweight, they're more likely to not tell people when they've got a problem. And these are all factors which contribute to men developing and getting too late to the services. If we're able to pick men up earlier with these conditions, then we could do more with them. And I think that's what Leeds is recognising now. We need to have services that are reaching out more effectively to target men. And in that case, in that way, see better health for men in the long term.
We do know there are gaps in information. And again, we've got to do more work to hear more about the voices of men and young people themselves to help us better understand how we respond, what our services should do in the future.
What you find when you look at men's health is the fact that a lot of men develop and die prematurely from conditions that should affect men and women equally. More men develop cancer and die from cancer. More men develop cardiovascular disease and die from cardiovascular disease. Respiratory disease. 5 times more men in Leeds are dying from suicide. Across all the different areas of health that you think are important, when you actually start to look into it more deeply, you find that men are struggling.
This report paints a very, very helpful picture for us. It's our responsibility now to take the findings from those reports and use it in making sure that our services better respond to the needs of men and young people, and we can actually make sure that we do improve the health of men in Leeds in the future.